Hi, I'm Dr. Michelle Cespedes. I'm a doctor here at Mount Sinai, the Icahn School of Medicine at Mount Sinai here in New York City, and I am a specialist in infectious disease. Today I've been asked to talk about COVID. This is a great question, and I get asked this by not just patients, but also coworkers of mine and also family members. So one of the things some of my younger patients have been asking, even some of my younger family members have been asking, they're like, is there still COVID around? Is it that bad? And because I'm young, even if I get it, it probably shouldn't be that bad. So what I always say is that I think my perspective is different and unique because I took care of so many people who were so sick, and unfortunately some who didn't make it, that I'm skewed to think of, or maybe, be more experienced with some of the poor outcomes. So what I do is actually don't, insult people's intelligence or other things like that. But what I actually try to say is that you are right. There actually is some data that if you're younger, you might not be as sick or ever come to the hospital. But that doesn't mean that you can't get it and actually maybe spread it on to other family members. This was especially important when I was discouraging people from visiting family members around the holidays, Thanksgiving, Christmas, New Year's. And if you remember, we saw that huge spike in cases, and unfortunately, in my line of work, increase in the number of people being hospitalized and intubated and taken care of in the intensive care units. So one of the things I say is that even if we don't expect you to become very sick, as part of taking care of everyone in the community, what we need to do is have people vaccinated so that they can't likely get the virus or it won't make them sick and they won't pass it on to everyone else. The other thing I like to remind people of is that there are many, many people who, maybe felt a little ill, but weren't sick enough to come to the hospital, maybe didn't have COVID pneumonia or need extra oxygen in some of the treatments we have. But there's some other side effects or long-term effects that we're seeing now that are pretty concerning. There's evidence that just like any other virus that causes inflammation, that sometimes that inflammation is not just in the lungs, but in other parts of the body. And the things that make me nervous, especially for young people, are anything that might affect the nerves from their brain and their brain itself. Not sure if you remember, a lot of people were saying, oh, I think I had COVID. I didn't feel quite well. I wasn't that sick, but I lost my sense of smell or things tasted funny. So that's kind of evidence that there's been inflammation in the nerve that controls your ability to smell, which comes straight off the brain. There are people who have been discussing or demonstrating what we kind of call colloquially as a brain fog. Kind of forgot what I'm doing, or I came into this room and I can't quite, but for many, many more months than expected after just kind of being ill or not feeling well. So again, even if symptoms are mild, I still recommend getting vaccinated so you don't get it at all, even if you don't get sick enough to be in the hospital, to prevent any of these long-term effects that we don't know how long they last. Two, for the principle of keeping the entire community clean, I think one of the other important reasons everyone should get vaccinated is for the public health of everyone. If there are fewer targets for the virus to jump to make sick, there are fewer people who can go on to spread the disease. If enough people don't get vaccinated, that'll take longer for us to get to that point. It would also actually give the virus more time to make small changes to how its structures come together and actually cause variants that maybe the immunity that we make won't be as strong to the new emerging versions of the virus. So the quicker everyone gets vaccinated, the less likely we are to have new viruses that will be able to outsmart the immunity that we are creating with the current vaccine. And then I also say, lastly, sometimes to especially with people I know or who know me and know what I do. I say, I remember when everyone was clapping and cheering at 7 o'clock in the evening last spring when we were coming home exhausted and tired. And people would ask me what they could do for me and can we help get you food or help you? I say now, anyone who's reluctant to get the vaccine, I actually tell them two things. And I said, I think it's reasonable or it's understandable why you might be nervous to take this vaccine. This is new. The virus is new. How quickly it came to be is new. And even some, I call it a trust deficit in terms of either doctors or scientists or anybody who wants to inject something in you. To those who ask me that, what I say is that even though the vaccine came to market in a relatively short period of time, what we do have is millions and millions of people who have gotten the vaccine since they've been FDA approved and available. So now we have even more information in terms of side effects, anything we should watch out for, and now even data about how well or how few new infections we are seeing in nursing homes who actually got the vaccine early, meaning that the vaccine is actually working in the sickest people, preventing them from getting sick or even coming to the hospital anymore. So now we have more data, more proof that it's even safe for you. We actually also have more data that as viruses emerge, the sooner we vaccinate everyone, the better it'll be for everyone. And your act of love for not just the community, but for me and all the appreciation for all the time and hardship that all of us as healthcare workers and staff in the hospital put out would be to get the information you need, but to get vaccinated as soon as you're eligible.
Great. Thank you so much for joining us again.
Thank you. Thank you for offering. And I look forward to everyone getting vaccinated as soon as possible.